minutes, you're going to learn about the role nutrition plays with the clients that you see every single day and why harnessing the power of food as medicine is so important to integrate into your clinical practice. I'm Hales, one of the planners here at PESI, and I'm here with one of the great experts on integrating nutrition with psychotherapy, the incredible Vicki Steine. Hi, Vicki.
Hi, Hale. How are you?
I'm great. How are you doing today?
I'm good. I'm good. Glad to be here. I appreciate it.
Good. All right, let's just jump right in.
Yeah.
Why is nutrition for mental health such an important topic to cover?
Well, um, that is the question that I could probably take all day answering. But the short answer is that our minds and our bodies are connected. And if we don't eat the right foods, then our body doesn't have the tools that it needs to make things like serotonin or dopamine or to help our gut to run the way that it's supposed to run. And that impacts brain health. So most of us, I was trained a long time ago, but even younger therapists who have been out of school for less time than me, um, they don't teach that in school. We talk a lot about talk therapy. We talk about all these other great tools like cognitive behavior therapy, and as we go through years of experience, we take on more things like DBT or hypnosis, but we rarely talk about or learn about nutrition. And so I equate it to like building a house. Like I could give you the lumber and I could give you the windows and I could say build a house. But if I don't give you the nails and I don't give you a hammer, how are you going to put it together? So we can have, you can have some of these great tools that are wonderful for mental health, but if you don't address what's going on with the body, you're missing this huge piece. So if I've got a client that maybe has a thyroid issue or is malnourished because they've been using drugs or alcohol, then I can do talk therapy all day long. But if I don't address those nutritional deficiencies, they really can't get any better. So if we want our clients to get better, if we want to be effective, then we really have to address this stuff.
Absolutely. And how often do you find that people struggling with mental illness are also struggling with a nutritional deficiency or something going on with their body? Does that happen a lot?
Well, I would say 100% of the time, because we all have deficiencies. Like even you and I sitting here and maybe taking really good care of ourselves, exercising regularly, getting sleep, doing all the stuff we're supposed to do. If I did your blood work or I did my blood work, we're going to be deficient in something. So if we have clients if just the baseline is our food is deficient, that everyone is deficient in something, and then you layer that with drug use, or you layer that with depression or anxiety or OCD or any of the other neurologies that we treat, you're going to find that they're going to have even greater deficiencies. And if you've got clients like that, like I do, that are on medication, like probably most of my clients are on medication, medication creates deficiencies as well. So even though they're taking something for anxiety or they're taking something for depression, they may still end up with other deficiencies that the psychiatrist hasn't even identified that can still be impactful on their mental health. And we've all had clients who've said, "Oh, I'm taking this medicine and it's not working." Well, it might be because there's a biological reason, like they might have a genetic SNP, a genetic issue that impacts how the medication works, and or like the whack-a-mole game, just because you give a medication, now they have a deficiency somewhere else that's popped up, but we're not addressing that. So the medicine can't work the way that it should. Or we just end up with some other aspect of depression or anxiety, even though they're taking medicine.
Yeah, there just seems to be so many different directions you can go when it comes to nutrition and mental health. What's the first step? What do you normally do with a client that's coming in?
So I usually I ask them first if they want to talk about nutrition, because I've learned that even though I'm passionate about it, it doesn't mean that they understand that. So, for example, years and years ago. I worked with this woman for 10 years. But when she first came into my office, the very first thing I did was give her an intake that was a nutrition intake. And she filled it out. She was really compliant. She filled it out. She brought it back. And she said, I really came to you for my depression. So I don't understand why we're talking about nutrition. So I've learned that I have to do a little setup first and kind of let people know. Now, I have a degree in nutrition, so people expect that. But I still like to warn people that as part of my treatment plan, we're going to look at nutrition. And it may not be the first session, it may be the second or the third session, but I'm going to definitely take a look at what they're eating, because I need to know what, if they're eating a ton of processed foods and I'm trying to work with them, they don't have the wherewithal to do what the work that we need to do in a lot of cases. Or like I had a client recently who, she has depression, she has ADHD, and she shared with me that she had had diarrhea for 2 weeks in a row. Well, I can't address mental health issues if somebody has that kind of a physical problem going on. And that means she's not keeping any nutrition. Like everything is literally running through her. So how can we possibly do any work if she's not well? So the first thing I want to do is evaluate what people are eating. And I want to evaluate their physical health. So I'm going to probably make sure that they have been to the doctor and that they've gotten a physical, and they get their lab work to me so that we can look at what's happening. And then I can work jointly with them and their physician if we need to. I don't always have to do that, but sometimes that has to happen.
So you have so much experience in nutrition and nutrition for mental health, but for the therapists or mental health clinicians who don't have this experience and don't know how to go about it, what is the best way, do you think, for them to gain this knowledge and to help integrate these types of strategies into their own practice?
Well, coming to our training would be a great way to do that. So I would absolutely love for people, if you've been listening and this is something that interests you, I would invite you to come in December and join us in Miami, where it's going to be nice, or Fort Lauderdale. We were going to be in Miami. We moved it. Where it's going to be nice and warm and beautiful. And then come and get 3 days worth of training. And then I can lead people to other options beyond that point, because I've been studying this for 13 years. There's new information that's coming out really daily. So keeping up with the information is challenging at best. So, I would say coming to our training would be fantastic. Get that certification, and then hopefully that sparks an interest so that you keep studying, because you have to just keep reading and you have to keep attending trainings and stay on top of the literature, because a lot of it changes and a lot of it doesn't, but you have to know which is which.
Right. I feel like nutrition for mental health specifically, things are changing all the time, and there's new reports. And I love the way that you always keep up to date on that and integrate it into your presentation.
Yeah.
But what would you say is the biggest mistake that clinicians do when it comes to working with someone who the problem may be nutrition and not solely mental health?
Well, I think that it's not being able to make that distinction. So you get somebody who appears to be depressed or appears to have anxiety, and you immediately jump to that conclusion because they check off all the boxes in the DSM-5, which is what we, coding wise, that's what we have to go on, as looking at our clients who just come in and we have to do our work based on self-report. So it's not like I have some sort of fancy machine like some doctors do, who can look at the brain. I can only go by what somebody is telling me. So if they tell me that they're not getting out of bed, and they tell me that they can't go to work, they tell me they're irritable, then I'm going to say you're depressed. But maybe it's something else. Like maybe they haven't been eating. Maybe it's, it could be anything. So I think jumping to the conclusion that it's a mental health issue, when in fact it could be partly mental health, or it could be something physiological. So like if you look at certain diseases like diabetes or IBS, irritable bowel syndrome, um, you're going to find people who tend to have depression or tend to have anxiety, but which came first? Do they have depression and they became diabetic, or vice versa? And are we asking those questions? So how many people do you have in your office that have diabetes or have um, some other physical illness like IBS that we don't think to ask about? So I think that the mistake is not asking the right questions and jumping to conclusions because of our training. It's not anybody's fault. It's just that's how we were trained. Look at the DSM, ask these questions, and oh, it must be depression. They check the boxes. Oh, it
Yeah.
must be ADHD. But maybe this, there's some new literature that just came out on red dye 40, and the fact that red dye 40, which is in about, I don't know how many, we get millions of pounds of that stuff in our food every single day, yearly. So what if that person it looks like ADHD, but in fact, they are eating a lot of foods that contain red dye 40. And maybe they just need to remove those things from their diet. So it's a huge different intervention to say, don't eat red dye 40 versus let's put you on medication for anxiety. It's huge.
Truly.
So trying to
After
figure that
after seeing your training for the first time and hearing about red dye 40, you have me terrified of it. I look at every package and I'm like, oh,
out.
red dye 40.
Good. That's great. I love it. Yeah, but think about how many kids and our clients who don't know that and don't do that. So
Yeah,
there are a lot of those little nuggets about what foods, or what chemicals are hidden in our foods that we should be avoiding, and what chemicals are in our environment that we should be avoiding, you
yeah,
know?
absolutely. I would assume it is so hard to differentiate between a nutritional problem and a solely mental health problem, or when it's both. And so you talked about going in with an open mind, but as you keep seeing these clients, what's a good way to figure out the differentiation? Like figure out if maybe this person really is solely just mentally ill and it doesn't have anything to do with nutrition.
Well, that's when you have to work. I don't work by myself. I mean, I'm in private practice by myself, but I have a network of people that I work with. So I've got functional doctors, and my patients always have their own general practitioner or pediatrician. And so that's when I'm going to partner with somebody else and say, I think we need to get you tested. So if they're having trouble sleeping and they're irritable, I might want them to explore whether they're having hormone issues, or maybe they just have insomnia, or maybe it's something else that we haven't. It could be their thyroid. So I want to have them go to a doctor. I want them to get tested because I don't want to guess. So if I do, I might start with just nutrition, like let's just look at what are you eating and then make some tweaks. But if somebody's not moving forward and getting better, then we're going to have to engage other testing. So the whole idea is test, don't guess. So I don't want to be just sort of having my eyes closed and throwing darts at a board. I want to have some real data and know what we're dealing with. So sending them off to a doctor, partnering with other professionals is in my opinion is really important.
Yeah, something I really love about this and your approach is that instead of putting band-aids over the symptoms, you try to go right to the source. And I
Yeah.
think that's really huge. Do you
Yeah.
find that integrating nutrition in this has made you more efficient as a therapist and has helped your clients more?
Well, I don't know if it's more efficient, but hopefully it's more effective. So, because sometimes all of that takes a lot of time, and frankly, a lot of clients aren't compliant. If I give them a food log and I say, please fill this food diary out, bring it back next time, and they come back and they'll say, oh, I forgot, or oh, I was too busy, so now we've lost a week's time. So then I get to decide, okay, do I want to ask them to do it a second time, or do we want to just sit in the office in that moment and say, tell me what you ate yesterday, which is usually what I would do. So it's, and then it's also a nice kind of fallback so that a lot of times clients come in and they have an agenda of what they want to work on, but a lot of times they come in and they don't. So anytime a client comes in and I say, so what do you want to work on today? And they say, I don't know, I was thinking about it on my way over here and I don't really have anything to talk about. I'm always going to circle back to, well, let's talk about nutrition. Let's talk about what you're eating. Let's talk about your sleep. Are you sleeping and are you exercising? Because those are, to me, those are the three legs of the stool that hold the person up. And we have to address all three of those: nutrition, sleep, and exercise. And if those things aren't in order, it's likely mental health will not be either. So unless they have something, burning that they have to talk about, we're gonna circle back to that, because I want their bodies to be in optimal health, because that means their brain is going to be operating optimally as well.
Wow. Thank you so much, Vicki. I feel like even I learned more about nutrition for mental health. And for anyone out there, if you would like to hear more from Vicki, you can join us in Fort Lauderdale or live online December 11th through the 13th. Early bird registration ends on Wednesday, November 15th. So you don't have much time, but you have a little more time to save $300 when you register now. So thank you so much, Vicki. It truly is always a pleasure to talk with you and learn from you. And thank you to everyone who joined us today. We'll see you
Yes.
soon.
Thank you.